Welcome again, everyone, to our COVID-19 community briefing, 6th edition. My name is Marty Guthmiller, and again, I am the CEO at Orange City Area Health System. I'm going to start out today, and you'll know I'm by myself, and so it's the first time solo on the briefing, so we'll see how that goes. What I want to do is just give you an update again, as we have been doing over the past week or so, on the scoreboard, as I call it. First of all, we've done now a total of 53 tests, 5-3. It remains at 3 positive, so we haven't had a positive in a fair amount of time now. Negative tests out of the 53 were 47, and pending are 3, so we should find those out today. So again, 53 total, 3 positive, 47 negative, and 3 pending. One of the reasons I'm by myself today is that all is quiet on the Western Front. In this case, the Western Front refers to basically Western Iowa. Things are calm right now. We just don't know whether or not this is the eye of the storm or if it is actually on the tail end. We'll talk about that a little bit more as we go on today also. What do I mean by the Western Front? As of Sunday, Iowa hospitals totaled 136 inpatient admits or inpatients with COVID-19 diagnosis. Sioux County, 0. Plymouth County, 0. Lyon County, O'Brien County, 0. Osceola County, 0. Woodbury, 1. And so when I refer to all quiet on the Western Front, that's what I'm referring to relative to those numbers. Now, of those 136, I have the top 4 for you. Lynn County leads the pack, so to speak, with 30. Polk County, Des Moines, 24. Scott, 12. And Johnson County, Iowa City, 12. I'd also like to talk a little bit about the IHME website that we've been talking about. Or the address actually is healthdata.org, healthdata.org. And you can go ahead and take a look at that. It is, as we've mentioned in previous briefings, it is a website that we've kind of settled in on relative to projections of COVID-19. Again, University of Washington, Bill Gates Foundation behind this website. And it's being used by others that we consider credible in this projection as well. While encouraging, it does still indicate that we are 22 days until peak, or if put into a calendar, that would come out about May 5. And so we have yet to reach the peak in Iowa, but again, as you notice by those demographics I gave you earlier, right now, things are pretty calm in our part of the state. The IHME data currently says that at its peak time, Iowa would need 566 beds, 566. We currently have available 4,297. Again, a shortage of 0. It also projects we would need 145 ICU beds. We currently have available in the state of Iowa 246. So a deficit there, again, of 0. So the main issue with IHME is that we need to remain vigilant on the social distancing measures that are in place. They do very much indicate that their projections are based on that they will continue to, that the population will continue to adhere to these measures. We have a nice weekend coming up and a nice week ahead. And so the temptation might be to relax a little bit in the 6-foot rules and hand washing and all that. Please don't. Get outside, enjoy yourself, do yard work, take walks, that kind of thing. But stay out of groups and when you do talk to people, again, stay at least 6 feet away. If you can do 10, that's even better. One thing that I just wanted to mention also is that Iowa is broken into 6 regions. across the state, so that as supplies are needed, beds, ventilators, that kind of thing, that the state can do a coordinated effort region by region. We happen to be in Region 3, and that comprises 20 counties in northwest Iowa. So it's a fairly good-sized region. From the Community Health Partners, or CHP website, I read this statement. Based on the metrics and numerical score IDPH has assigned to each of them, Regions 3 scores 5, with a 10 or more being the number at which shelter-in-place order would be issued. So this region, which consists again of 20 counties, is currently scoring 5, which is low relative to 10 being required for more sheltering in place to actually be ordered. So a little bit of information there on what's going on behind the scenes. Again, we hope not to have to use these regional coordination efforts any more than we do, but we're always glad to have them there and planning for a surge or a worst case scenario. So that's it for today. Again, all quiet on the Western Front. It's the way we like it. We're getting ready to get back to normal here, hopefully, but it'll be several more weeks. And so please stay vigilant, stay strong, and stay well. Thank you for joining us today.